So let's go over some presentation tips. Okay, so first of all, for your patient presentation, we would like you to present using slides along with your oral description of the case. Okay, so we are not asking you to write a patient case. We want you to give an oral description, an oral presentation of your patient case, and we want you to use PowerPoint slides or Google Slides. Okay, so that's as a support for you. So to help you with this, we have Google Slides that you can use here to present, to use as a starting place for your presentation. Okay, so if you click the link through Canvas or through your H&P workbook, you should get to this presentation template. You can download this as PowerPoint if you do that, if you have PowerPoint on your computer, or you can make a copy of the entire presentation, and then that will allow you to edit the slides. Okay, so these slides are very simple. We just have the main information on the slides. So if you see here, you'll start with the chief complaint, HPI, all of the history for your patient. Then we'll get to physical exam findings, lab and radiology findings, assessment, differential diagnosis, treatment plan and outcome, and then questions at the end. Okay, don't be overwhelmed by this. We're gonna go through this with you, okay? We're gonna go through every part of this presentation. So what we ask for you to do is click on the link, get this presentation, save it as either a PowerPoint or as a Google slide that you can edit, so that you can work on adding the information about your patient to the slides as we progress and work through the course. Okay, next tip for you. So we are focused on improving your fluency through this course. So in order to help you with this, we would ask you to use bullet points on your slide and avoid writing full sentences so that you're not tempted to read from your slides. Okay, so I'm going to give you an example from one of our students who does a really great job with this. Okay, so these are her slides. And she has bullet points with all of the key information about her patient case. Okay, so you see she doesn't have full sentences, and this allows her to present it naturally. Okay, so if I'm gonna present from these slides, I would say something like, so let's talk about this patient together. So we have a 34-year-old nulliparous female who presents to my clinic with lower right-sided abdominal pain that started 2 days ago. The patient rates the pain as an 8 out of 10 pain that's associated with dark red vaginal bleeding. Her last period was 6 weeks ago. Associated symptoms include dizziness, nausea, and fatigue. Okay, so you see, if I had the bullet points here, I am speaking about the information, but I'm not reading directly full sentences from the slide. Okay, and then you see here, just an example for her past medical and surgical history. She just has the information, so diabetes, 2 episodes of salpingitis, 2 miscarriages, a history of infertility for 5 years. Okay, so then as she's presenting this, she could say something like, the patient's past medical history includes diabetes. She's also had 2 episodes of salpingitis, as well as 2 miscarriages. Significantly, the patient has a history of infertility for the past 5 years. Okay, so I would say this information, but I would not read directly from the slides. Okay, so that's our second tip. And then third, helpful tip as you prepare, we want to give you the rubric or how we're going to grade your final presentation. So we have a lot of different things that we're looking at as we watch your presentation and as we give you feedback. And so we want you to know what we're grading you on. Okay, so let me pull up this rubric. So you can look through this on your own. You have a PDF in Canvas. And so you can look through what we're grading you on. So we're kind of looking at overall organization, the content. So this is focused on especially the medical content, but also things like that there's no minimal spelling errors on your slides, or your use of transition language. Okay, and then we're looking at some presentation skills. So things like having a good understanding of pronunciation, that your delivery is poised and smooth, that you speak fluently without reading directly from your slides, that the length is appropriate. So you can look through all the different things that we're going to be grading you on in this rubric, and that will help you to prepare. We're going to highlight some of these specifically as we go through some of the presentation tips in the coming lessons. So as we work through these tips each unit, we're going to focus on some of them, but we just want you to have an understanding of what we're looking for when we're grading your presentations. Okay, so let us know if you have any questions about any of this. We are here to help you, and we want you to be successful in this patient presentation.